Welcome to Coffee Time. We're back again with Mike and Janell. Today we want to discuss autism and comorbidity. And comorbidity is when there are two or more chronic conditions in a patient at the same time. So, oftentimes, patients we meet come to us with multiple diagnoses, including ADHD, OCD, impulse control disorder, bipolar disorder. The list goes on and on and on. And Dr. Cummings has a saying that he repeats all of the time, and it is that autism looks like a lot of different things, but it is protective of nothing. So I'm imploring Dr. Cummings to elaborate on that thought for
Well,
us today.
thank you, and hello everyone. You'll see us with our brand new APEC mugs as well for our coffee talk. So autism can look like any number of conditions, and most commonly, conditions that it often gets confused with are things like attention deficit disorder, um, OCD or obsessive compulsive disorder, bipolar disorder, even schizophrenia, and that's because a lot of the core symptoms of autism overlap with each one of these diagnoses. So it's very easy to see how people can be confused, particularly in a child who's more neurotypical. So there isn't an obvious intellectual or developmental disability upon first look. So it can be very confusing. But that said, even though autism does look like a lot of things, it doesn't prevent you from having any of those things. So the rates of ADHD, OCD, bipolar disorder, schizophrenia, and countless other disorders aren't less in an autistic individual. So it's quite possible that when someone presents to you with symptoms that look like other things, that's just their autism. But it also could be that they have any one of these other conditions, which makes it very complex when you're diagnosing and treating.
So any person is susceptible to mental illness, regardless of developmental or
Correct.
intellectual disability. And so, can you just tell us why it is so important to make sure that we have the correct diagnoses when we're treating these patients?
Well, of course, and diagnosis is a process, right? I think people think they come in, they see a psychiatrist or a developmental pediatrician or psychologist, and they do some tests or they talk to you briefly, and then they know what your diagnosis is. Sometimes it can take months or even years to fully determine
Mm-hmm.
diagnosis, particularly when you start with a younger child. But the reason why it's so important is because treatments, and not just medications, behavioral treatments, therapy treatments, educational interventions, and of course, medications, the treatments stem from what the actual diagnosis is. And often in psychiatry, and certainly in psychiatry with individuals with developmental disabilities, patients are often treated based on their symptoms only. So if you can't sleep, there's a pill for that. If you are hyperactive, there's a pill for that.
Mm-hmm.
If you're aggressive, there's a pill for that. And that goes on and on. And the concern about that is first is people end up with a lot of medications, but all medications, even if they're not helpful, will have side effects, and side effects that occur particularly in a non-neurotypical population, who may or may not have a lot of words
Mm-hmm.
to express discomfort and other feelings. Um, uh, Side effects can drive actual negative behaviors that can then make people think that they may have conditions additionally.
And they're not able to verbalize
Exactly.
such. Yes, yes. So we see that a lot. We have many patients who are on probably five, six, seven, eight psychotropics, and it's very concerning because of the impending medical conditions, and side effects, as you noted. So we spend a lot of time with APEC trying to actually wean folks off meds, particularly if we're not finding that they are effective in treating target behavior. So um, polypharm polypharmacology is when multiple medications are used to treat something, and we unfortunately see that a lot. And we'd like to have a follow-up discussion next week on just that topic.
Absolutely. It's a very important topic. As always, if you have questions about your medications, questions about your child's diagnosis, first and foremost, reach out to your primary care doctor, psychiatric provider, and of course, you can always contact APEC for guidance with who to link up with.
Great. Until then, stay healthy and safe, folks.
APEC out.